Good evening, everyone, and welcome to the Twin Rivers Triangle Environmental Coalition meeting. On behalf of Chasten Gold nonprofit, thank you for joining us. We are grateful to welcome those attending in person, everyone participating online, and community members who may view this recorded presentation later. I will be serving as tonight's facilitator alongside our TAG Grant community engagement representatives and technical advisors. Tonight's presentation is titled Risk, Communication, and Health Resources. Environmental information can sometimes feel frightening, especially when people hear words such as contamination, exposure, toxic chemicals, or health risk. These terms may create understandable concern, particularly when families are thinking about their children, homes, schools, parks, and long-term neighborhood health. Tonight, our goal is to explain what environmental professionals mean when they use the word risk, discuss practical ways residents can reduce possible exposure, identify health resources that may be available, and explore how clear communication can reduce confusion while building public trust. This meeting is educational and is not intended to diagnose any medical condition or replace advice from a qualified healthcare professional. If you have a personal health concern, we encourage you to speak directly with a healthcare provider who can consider your individual circumstances. Whether this is your first coalition meeting or you have attended previous sessions, we appreciate your participation. Your questions, concerns, and lived experiences are essential to creating a more transparent and community-centered environmental process. As always, before we begin tonight's main discussion, we would like to introduce Chasten Gold for anyone participating for the first time. Chasten Gold nonprofit is committed to advancing environmental health, racial equity, housing stability, and community empowerment across Sacramento and surrounding counties. We work in partnership with residents, organizations, and public agencies to amplify local voices, deliver independent technical assistance, and address systemic barriers through direct service and advocacy. Our focus also includes engaging and empowering impoverished and unhoused veterans, families, and individuals seeking assistance with employment, shelter, and connections to appropriate services within their local communities. Through the Technical Assistance Grant, Chasten Gold helps residents understand environmental information that may otherwise seem highly technical or difficult to access. Our team helps explain environmental reports, sampling results, cleanup terminology, possible exposure pathways, and community participation opportunities in plain language. Our role is not to replace regulatory agencies, environmental consultants, or healthcare professionals. Instead, we serve as an independent community resource that helps residents understand information, prepare informed questions, and communicate concerns. At the heart of the Technical Assistance Grant is a simple truth. Communities deserve to be heard, informed, and empowered. Through this grant, we provide trusted support to help residents better understand environmental issues, participate in decision-making, and advocate for lasting change. Whether someone is navigating a complex cleanup process, trying to understand whether contamination may affect their neighborhood, or seeking resources to protect their family, Chasten Gold is here to help ensure that community voices are amplified and supported by technical guidance and educational resources. Together, we are not only addressing contamination, we are building pathways toward environmental justice, transparency, accountability, and a healthier future. Risk communication is an important part of that work. Residents deserve information that is accurate without being unnecessarily alarming, honest without being dismissive, and clear enough to help families make informed decisions. Good communication should explain what is known, what is not yet known, what is being done, and what residents can reasonably do next. Let us review tonight's agenda. First, we will discuss what the word risk means in an environmental setting. Second, we will review practical protective behaviors that residents may use to reduce unnecessary contact with soil and dust while investigations continue. Third, we will identify available health resources, including public health agencies, primary care providers, poison control services, community clinics, and environmental health programs. Our research topic will examine how clear, honest, and consistent risk communication can improve public confidence and community participation. We will then conduct a 10 to 15-minute breakout exercise focused on the information families need to understand environmental risks. After the breakout session, we will discuss what types of information help residents feel informed rather than worried. We will also respond to community questions and conclude with opportunities to remain involved. Please write down any questions that arise during the presentation. We will provide time for questions and discussion later in the meeting. Before discussing environmental risk, let us briefly revisit the Twin Rivers Triangle site and the purpose of the Technical Assistance Grant. The Twin Rivers Triangle project site is located in Sacramento, California. The Technical Assistance Grant Program provides funding to eligible communities so they may obtain independent technical advisors. The purpose is to help residents better understand technical environmental information and become more informed and involved in cleanup sites and response actions. Response actions may include work performed to investigate, control, remove, or otherwise address an actual or potential release of contamination at a property under regulatory oversight. The Sacramento Housing and Redevelopment Agency, commonly referred to as SHRA, purchased the Triangle site in July 2011. The property was acquired with the intention of transferring the light rail station portion to Sacramento Regional Transit for construction of a light rail station and redeveloping the Triangle housing site with residential units and possibly ground floor retail space. Cleanup addressing heavy metal impacts in near-surface soils was performed at the light rail site in 2023. Further environmental assessment and subsequent cleanup activities for the Triangle housing site were planned for the 2025 to 2026 period. This background matters because environmental risk must always be considered in relation to the specific site, the contaminants being evaluated, the possible exposure pathways, and the property's current or proposed future use. A property planned for housing may require careful evaluation of how children, families, workers, and future residents could use the site. We will now begin our first major topic, what the word risk means. When residents hear that contamination has been detected, they may understandably assume that immediate danger has been confirmed. However, the terms contamination, exposure, and risk do not all mean the same thing. A contaminant may be present in soil, groundwater, dust, air, or vapor. Exposure describes whether and how a person may come into contact with that contaminant. Risk considers the possibility that the exposure could result in harm under specific circumstances. Environmental professionals therefore ask several questions. What substance is present? How much is present? Where is it located? Can people come into contact with it? How often might contact occur? How long could the exposure continue? Who could be exposed? These questions help determine whether an exposure pathway exists and whether protective or cleanup measures may be needed. The first statement on this slide is especially important. Risk does not automatically mean danger. Environmental risk is evaluated by considering several factors together. The first factor is the type of contaminant. Different substances have different properties and potential health effects. The second factor is how people may be exposed. Possible exposure routes may include touching contaminated soil, swallowing soil or dust, breathing dust or vapors, or consuming affected water or food. The third factor is how often exposure may occur. A one-time contact is different from repeated contact that occurs every day. The fourth factor is the length of exposure. A brief exposure is different from exposure that continues for months or years. Scientists evaluate both the presence of contamination and the possibility of exposure before reaching conclusions about health risks. This means that finding the contaminant does not, by itself, answer every health question. Investigators must also evaluate whether people can reach it, how much exposure could occur, and under what conditions. For example, contamination located several feet underground beneath intact pavements may present a different exposure situation from contaminated soil exposed at the surface in an area where children regularly play. The same contaminants may therefore create different levels of concern depending on its location and the exposure pathway. When discussing risk, it is also important to communicate uncertainty honestly. Environmental professionals may not always have every answer at the beginning of an investigation. Sampling may still be underway. Laboratory results may still be under review. Additional areas may need to be tested. A trustworthy explanation should clearly separate three categories: what is currently known, what remains uncertain, what is being done to obtain more information. Residents should be cautious when anyone makes absolute statements without sufficient information. Statements such as, "there is absolutely no risk," or "everyone is in immediate danger," may both be inappropriate when site-specific data are incomplete. Clear communication explains the evidence without exaggerating it and without dismissing reasonable concerns. We will now discuss simple protective behaviors. Protective behaviors are practical actions residents may take to reduce unnecessary contact with soil, dust, or debris. The steps do not mean that every household has been exposed or that an emergency has been confirmed. They are common sense practices that may reduce everyday contact with outdoor dirt and dust while investigations or construction activities continue. These actions may be especially helpful for households with young children, who often play close to the ground and may place their hands or objects in their mouths. The first protective behavior is washing hands after outdoor activities. Children and adults should wash their hands after gardening, playing outside, handling soil, or participating in outdoor work. Hand washing is especially important before eating, preparing food, or touching the face. The second behavior is removing shoes before entering the home. Shoes can carry soil, dust, grass, and outdoor debris into indoor living areas. Creating a shoe removal area near the entrance may help limit the amount of outdoor soil trapped inside. The third behavior is washing fruits and vegetables. Produce should be rinsed before eating, particularly when it comes from a home garden or outdoor market. Root vegetables may require additional cleaning because they grow directly in soil. The fourth behavior is limiting dust inside the home. Residents may use damp cleaning methods rather than dry sweeping, which can stir dust into the air. Regularly wiping surfaces with a damp cloth and using a vacuum with appropriate filtration may help control indoor dust. The fifth behavior is following construction and safety notices. Residents should respect fencing, warning signs, restricted areas, and instructions issued during investigation or cleanup activities. Children and pets should not enter active work areas or play with equipment, soil piles, or construction materials. These actions may help reduce unnecessary contact with contaminated soil or dust while investigations continue. Again, these are general protective practices and should not be interpreted as confirmation that a specific household has experienced harmful exposure. Residents may also consider several additional common sense practices. Keep children from playing in bare soils within active or restricted work areas. Cover outdoor sandboxes when they are not in use. Wash your children's hands and toys after outdoor play. Keep pets away from construction areas and wipe their paws if they walk through dusty outdoor spaces. Avoid bringing visibly dirty work clothing into sleeping or eating areas. Follow any site-specific instructions issued by the responsible agency or project team. Report damaged fencing, uncontrolled dust, unusual odors, standing water, or unsafe activity to the appropriate project contact. Residents should not enter restricted areas to collect their own samples. Personal sampling without appropriate training may create safety concerns, disturb evidence, or produce results that are difficult to interpret. Questions about sampling should be directed to the project representatives, oversight agency, or Chasten Gold technical advisors. Our next topic is available health resources. Residents sometimes ask where they should go when they have questions about possible environmental exposure. The appropriate resource depends on the concern. A technical advisor can help explain environmental reports and possible exposure pathways. A healthcare professional can evaluate personal symptoms, medical history, age, pregnancy status, existing health conditions, and other individual factors. Public health and environmental health agencies may provide broader information about community-level concerns. It is important to use the right resource for the right question. The first resource listed is Sacramento County Public Health. Public health professionals may provide information regarding community health, environmental health concerns, health education, and available local services. The second resource is a primary care provider. A doctor, nurse practitioner, physician assistant, or other qualified healthcare provider can evaluate an individual's symptoms and medical history. Residents should tell their provider why they are concerned, what type of possible exposure they believe may have occurred, when it may have occurred, and whether other household members have similar concerns. The third resource is California Poison Control. Poison control professionals can provide guidance regarding suspected poisoning or chemical exposure and help determine whether immediate medical care may be necessary. The fourth resource is a community health clinic. Community clinics may provide care to residents who do not have a regular provider or who need accessible and lower-cost services. The fifth resource is an environmental health program. Environmental health programs may address concerns involving contaminated properties, hazardous materials, water, air, food safety, or other community environmental conditions, depending on the agency's authority. Health professionals can answer questions about symptoms and recommend appropriate care if concerns arise. Environmental professionals can explain what substances were found, where they were located, and whether exposure pathways are being evaluated. These roles are connected, but they are not identical. Residents should seek emergency assistance when someone is experiencing a serious or life-threatening condition. Examples may include difficulty breathing, loss of consciousness, severe confusion, seizures, serious burns, or another urgent medical emergency. For less urgent concerns, residents may contact a healthcare provider or poison control professional for guidance. It is not helpful to assume that every symptom is caused by environmental contamination. Many symptoms can have multiple causes. A qualified healthcare provider is best positioned to evaluate personal health concerns. When speaking with a provider, residents may wish to bring any available public notices, fact sheets, or information identifying the substance of concern that can help the provider understand the context. Tonight's research topic focuses on how clear risk communication builds public trust. Communities are more likely to participate in environmental projects when information is presented clearly, honestly, and consistently. Plain language helps residents understand complicated ideas. Visual graphics can help explain sampling locations, exposure pathways, cleanup areas, and project timelines. Regular communication helps prevent residents from feeling that information is being withheld. Trust can be damaged when different representatives give conflicting answers, when technical language is not explained, or when residents receive information only after decisions have already been made. Clear risk communication should include several elements. First, explain the concern in plain language. Second, identify what is known and what remains uncertain. Third, explain what actions are being taken. Fourth, tell residents what they can reasonably do. Fifth, provide a clear contact for follow-up questions. Sixth, continue providing updates even when there is no final decision. Good risk communication does not promise certainty when certainty does not exist. It provides the best available information and explains how future evidence may change the understanding of the site. Let us consider two examples. An unclear statement might say, "Contaminants were detected, but there is no reason to be concerned." This statement may feel dismissive because it does not explain what was found, where it was found, or why concern is considered limited. A clearer statement might say, "Lead was detected in several soil samples within the fenced project area. Additional sampling is being conducted to determine the extent of the affected soil. The area is not currently open to the public. Residents should remain outside the fenced area and contact the project team with questions." The second statement provides context. It identifies what was found, explains what remains under investigation, describes the current protective measure, and gives residents an action they can take. Clear information helps people understand the situation without minimizing concerns or creating unnecessary fear. We will now transition into tonight's breakout session. We will divide participants into 4 groups. For those joining online, we will use virtual breakout rooms when possible. Participants joining by telephone or anyone unable to enter a breakout room may remain in the main meeting with a facilitator. Each group will discuss the following question: what information would help your family better understand environmental risks? Each group must choose its top 3 priorities from the following options: health information, sampling maps, cleanup schedule, children's safety, air monitoring, soil testing results. After selecting your top 3, explain why those items are most important. Please also discuss how the information should be presented. For example, should it be provided through a fact sheet, public meeting, text message, email, website, printed flyer, video, map, or neighborhood event? Please choose one spokesperson and one note taker. You will have approximately 10 to 15 minutes. When we return, our mediator will read responses from 2 groups aloud. The remaining group responses will also be documented for the meeting record. We will now begin the breakout exercise. Welcome back, everyone. Thank you for participating in the risk communication exercise. Both groups identified the need for information that is practical, visual, timely, and connected to daily family life. Residents do not only want technical data, they also want to understand what the information means for children, homes, outdoor activities, construction schedules, air quality, and access to healthcare. This exercise demonstrates why risk communication should begin with the questions residents are actually asking. Both groups identified the need for information that is practical, visual, timely, and connected to daily family life. Residents do not only want technical data, they also want to understand what the information means for children, homes, outdoor activities, construction schedules, air quality, and access to healthcare. This exercise demonstrates why risk communication should begin with the questions residents are actually asking. We received an important community question. Should I be worried if contamination is found near my neighborhood? It is understandable to feel concerned when contamination is identified nearby. However, the presence of contamination does not automatically mean that every nearby resident is being exposed or that a harmful health effect will occur. The next question should be, what contaminant was found? At what concentration? Where was it found? How deep is it? Can it move? Is the area accessible to the public? Are there complete exposure pathways? What protective measures are already in place? What additional investigation is planned? Concern should lead to informed questions, not panic. Residents should review official information, follow site-specific safety notices, avoid restricted work areas, and contact appropriate professionals with questions. If you have personal health concerns, speak with a qualified healthcare provider. Chasten Gold can help residents understand publicly available environmental information, but we cannot diagnose health conditions. This coalition is meaningful for several reasons. First, it helps address environmental inequities. Many Sacramento neighborhoods, particularly low-income and historically marginalized communities, experience greater exposure to pollution, contaminated properties, industrial activities, and poor environmental conditions. The coalition seeks to close these gaps and advocate for cleaner and safer environments. Second, the coalition empowers community voices. Residents deserve a seat at the table when decisions are made about their health, land, housing, neighborhood, and future. This coalition helps ensure that communities are heard, informed, and involved in environmental decision-making. Third, the coalition promotes accountability and action. By bringing together residents, advocates, experts, organizations, and local leaders, the coalition can ask important questions, request clearer information, increase transparency, and support solutions that protect public health and the environment. Risk communication is also an environmental justice issue. Communities deserve the same timely, accurate, and understandable information regardless of income, race, language, housing status, disability, or zip code. There are several ways residents can support this coalition. You can participate in person or through the live online question and answer section. You may submit comments before or after meetings. You can volunteer to assist with outreach, educational events, community surveys, meeting support, or information distribution. You may also submit scientific research, community observations, lived experiences, and questions for our technical advisors. The slide lists support at chastengold.org for questions and community information. You can also share coalition materials with neighbors, schools, faith communities, tenant groups, local organizations, healthcare partners, and other trusted community networks. Participation does not require a scientific background. Your time, experience, and knowledge of the neighborhoods can all support this work. Volunteers and supporters may be recognized through Chasten Gold's website and annual report. They may receive invitations to fundraising events and other community activities. Most importantly, volunteers become part of a committed group of residents and supporters working toward a healthier future for today and tomorrow. Volunteers may help distribute environmental health information, support community meetings, collect feedback, assist with youth education, connect residents with services, or help ensure that information reaches households that may not use digital platforms. Every contribution helps expand the reach of community education and environmental engagement. We welcome continued communication after tonight's meeting. Questions, comments, research links, community observations, or requests for clarification may be emailed to support@chastengold.org. Residents may also visit www.chastengold.org. Please include Twin Rivers Triangle TAG in your email subject line whenever possible, so the message can be directed to the appropriate team member. When submitting a question, it may be helpful to identify the specific slide, report, location, environmental term, or health resource topic connected to your concern. Please remember that Chasten Gold can help explain environmental information, but personal medical questions should be directed to a qualified healthcare professional. As we conclude tonight's meeting, we would like to thank everyone who joined us in person and online. Thank you for listening, participating in the breakout session, asking thoughtful questions, and sharing what types of information help your family feel informed rather than frightened. Tonight, we learned that environmental risk involves more than the presence of contamination. Risk also depends on how people may be exposed, how often exposure may occur, how long it may continue, and who may be affected. We've reviewed practical protective behaviors, including washing hands after outdoor activities, removing shoes before entering the home, washing produce, limiting indoor dust, and following construction safety notices. We identified available health resources, including public health agencies, healthcare providers, poison control professionals, community clinics, and environmental health programs. We also learned that clear, honest, consistent communication can improve public trust and strengthen community participation. The central message from tonight's meeting is this: residents deserve accurate information, practical guidance, honest explanations of uncertainty, and access to professionals who can answer both environmental and health-related questions. Please continue submitting questions and comments to support@chastengold.org. Your voice helps strengthen this coalition and supports a more transparent, equitable, and community-centered environmental process. On behalf of Chasten Gold Nonprofit, our TAG Grant community engagement representatives, technical advisors, volunteers, and community partners, thank you for being part of tonight's Twin Rivers Triangle Environmental Coalition meeting. Please travel home safely, take care of yourselves and one another, and have a wonderful evening. Thank you, Sacramento.